One of the first questions people ask is the risk versus benefits of vaccinations. Vaccines work by helping develop immunity towards certain diseases and infections by helping our bodies produce memory cells. These memory cells work against future larger diseases and infections. There are certain vaccines, different types of vaccines that are inactivated toxoids, conjugated vaccines, and they all have a different mechanism of action on how they work. But the most important message to send home is that they prevent larger diseases and infections for all of us community-wide in the future. I think it's always on someone's mind before they get a vaccination what the potential side effects of vaccinations are. Every side effect to every vaccine is different, so I think it's important that the message to take home is when you get an individual vaccination, you review before you leave the office those potential side effects with your practitioner. I think the vaccination information sheet is also used as a reference, so if you forget any part of that conversation with your practitioner, you have it in your hand and you can check against what you're experiencing at home and ensure that you're not experiencing any of those side effects, and if you do, not to worry, to make sure that you have communication with your primary care physician or your pharmacist to evaluate whether or not those side effects are significant and whether or not you need to pursue them at the next level. If an adverse reaction occurs, there is an important mechanism already in place through the FDA to report those reactions and side effects. And what happens is the FDA compiles that information and reports it back to practitioners. So if there's any trends, any concerns moving forward, that data is compiled and we as practitioners can assess whether or not the safety of that vaccination is in question. One of the questions that often come up is why so many vaccinations now as opposed to when I grew up? And I think the answer to that is that we're better equipped. We have more knowledge now. Our exposure hasn't changed. We're still exposed to the same type of diseases that we were once exposed to when vaccinations for these diseases weren't created. However, we're just better equipped to be able to handle them because vaccinations are now available. I think when information and technology affords us the opportunity to do these things, we should as a society take advantage of that. Vaccinations start as early as birth. And I think it's important to note that the vaccination schedule as recommended by the FDA should be adhered to. The hospital certainly provides those vaccinations and makes available those vaccinations to newborns. And if there's any concern, providers at the hospital, including pharmacists and nurses, are ready to have conversations with those new parents to discuss what the options are, what their concerns are. If they have any questions about the safety profile of the vaccination, we're here for you to answer that, to ensure that those children receive those vaccinations before they leave so they're protected and the community is protected. We have to have open dialogue with our patients to ensure that we can talk about their fears and concerns associated with vaccinations so we can answer any questions in order that we reach our goal. Adults need to know that it's important to also have conversations with their primary care physician about taking care of their own health through vaccinations. We know that vaccines prevent infection and disease, but now we have vaccinations, and this is such an important point, that prevent cancer as well. So those conversations with primary care physicians about what we're impacting, long term are so important. The more education we have for us and our children, the better off we stand as a community, as a nation in preventing real prevention associated with just disease, cancer, and infection in general.